see if it'll let you record. Okay. All right. Okay, let's go ahead and get started. I'm just gonna, for time's sake, I'm gonna let Susan, most of y'all know her. I'm gonna let you she's just gonna introduce herself and we'll get started on why we're talking to you guys today.
Okay, yes, I'm Susan Greenwood. I'm the System Vice President and Chief Nursing Officer for Hendrick Health. The purpose for today is that Hendrick Health is releasing an updated version of its safety dial this afternoon. This is the safety dial where we rate the level of severity of COVID transmission from a 1 to 6. Currently, we're at a phase 4, and that is based on the current transmission rates, hospitalized rates, the percent positivity in the community. We are adding some information today to be able to speak to our community about what is different with the current surge that we are experiencing with COVID-19. There's going to be 2 pieces of information at the bottom of that safety dial. The first is the percent of unvaccinated patients currently hospitalized. And the second piece of information is the percent of patients currently unvaccinated that are in the ICU. Today, 91.78% of our patients hospitalized are unvaccinated, and 100% of our patients in the ICU are unvaccinated. And that is really the difference that we are seeing with this current surge. We have mapped our surge that we experienced in July of 2020, along with the surge that we started experiencing in October, and it lasted until early spring, against the surge that we're currently experiencing. And so far, the uptick of cases that we are experiencing with this surge is greater than either of the previous 2, but it is different. We are seeing a younger age population be hospitalized, and the majority of these patients are unvaccinated. So in previous surges, it was the elderly and the patients that had multiple chronic conditions that were really at risk for severe illness and death. And what we are seeing is that has completely shifted, and it really depends on vaccination status. We do have a few patients that are vaccinated or partially vaccinated in the hospital, but they are not acutely ill. It is the unvaccinated that are in the ICU. We are seeing a younger population. Currently, our average age in the ICU is 48, and that is much lower than what we experienced the previous 2 surges. And we have patients less than 30 years old on the ventilator. We have had pediatric patients in the hospital. So it is a different ballgame this time. It appears to be more aggressive. We are on a stronger uptick, and the game changer at this point is vaccination. So that's the information about what we are releasing and why we added that information to the safety dial. And I certainly will entertain any questions that you might have about why we chose to include that information for our community.
So apparently there's like a new study out that the Pfizer vaccine efficiency drops at like 4 months. Is it possible that the drop efficiency is like responsible for the breakthrough to all the cases that we're having now?
Well, again, that's a great question, and that's exactly why we're adding the information that we're adding to our safety dial, because we are seeing patients that were vaccinated acquire COVID-19. But the difference is that the patients in the hospital have not been vaccinated. So even though we are having breakthrough cases where previously vaccinated patients are getting COVID-19, it is not a severe form of the illness requiring hospitalization. 92% of our patients in the hospital today are not vaccinated, and 100% of our patients in the ICU are not vaccinated. And so the difference is not age related. It is not the presence of chronic conditions like it was the previous 2 surges. The difference this time with this Delta variant that we know is much more contagious and appears to be more extreme in the younger population. The difference, really the game changer in what is causing people to get sick enough to come into the hospital and sick enough to be in the ICU is whether they've had a vaccine or not.
I had a question in regards to the young lady who recently passed after giving birth. Did she die from the Delta variant in particular? And when exactly did she pass?
So I think that there is a little bit of misinformation that somehow was perceived from the press conference this morning. And so I'm going to let Annette Lerma, who does an excellent job, clear up that with you all.
Mari actually already put something out just a few minutes ago.
Okay.
About trying to clarify that information.
Okay, so I can confirm that we have had young people pass away, unfortunately, but how all that information was put together in that story is not accurate, so I can't speak to that.
Have any numbers
Okay.
that are specific to the Brownwood campus?
If that's a question, I'm not able to hear you, I'm sorry.
I'll try again. I was asking if you have any numbers that are specific to the Brownwood campus.
I do. We have 13 patients today in our Brownwood hospital that will be on the safety dial this afternoon. And I believe 2 of the patients in the hospital today are vaccinated.
And those numbers that you're giving overall, do they apply to the entire trauma region? I think it's Region D, isn't it, that we're in? Or are they specific more to the Abilene campuses?
So they are specific to the Hendrick Health campuses of Hendrick North, Hendrick South, and Brownwood. It is not on our safety dial. We don't have the percent of vaccinated in the trauma region. It is the patients that are getting sick enough to have to be in our hospital and the percent of those that were vaccinated or unvaccinated.
There has been like a lot of talk about the potential like booster shots. Is that something you guys are considering or discussing?
So there is some pretty good evidence out there that a third booster is going to be needed and recommended. At this point, it does not have emergency use authorization, so we're not authorized to give that third vaccine. If and when that is authorized by the FDA, we will certainly make that available to our community and to our employees. It does appear that the research is showing that that will be beneficial. So we look forward to that authorization from the FDA. I do want to make a plug for information that you probably have received. Next Tuesday, August the 10th, we are partnering with the historical Paramount Theater to do a vaccination clinic, but it's a little bit different this time. We have put together an expert panel of physicians and providers and community leaders to answer the questions and concerns that community members that haven't been vaccinated might have to make that final informed decision about whether they want to get vaccinated or not. The panel will be available for a full hour at the theater. And then following that panel session, we will be doing a vaccination clinic from 1 to 6. We will have Pfizer available, which is the vaccine that has been approved in the youngest population. So 12 years and older can receive that vaccine, and we will be set up ready to do that. So I will defer questions about the vaccine itself to that date and time, because I know there's a lot of people that are saying we don't know the long-term effects of the vaccine, and I'm going to leave those questions to that Q&A session. But I will tell you that we do know the effects of COVID infections, and that is that it is infecting our younger population. They are getting sick just like the elderly and those with chronic conditions did in the previous 2 surges. It is affecting women that are pregnant. It is affecting our youth. And we are seeing long-term effects from COVID with lung scarring and lung injuries. We have patients in our pulmonary rehab clinic that are trying to rehabilitate their lungs that were previously working young adults. So we'll leave the questions to the COVID vaccine for next week, but we do know the long-term effects of COVID, or we know that the outlook is not good. And so I just encourage anyone who is considering getting a vaccine but has questions to attend that event. Because with this surge, it does appear that the vaccine is really the game changer.
One more question related to Brownwood. Are there any patients in the ICU in Brownwood or that have passed that are vaccinated?
There have been, yes. There have been patients in the past week in the ICU at Brownwood that were vaccinated. But again, the severity and the length of illness of these patients appears to be less severe, less long-term, less length of stay in the ICU for those patients that got vaccinated versus the patients that didn't get vaccinated.
And I think from what you said earlier, it's only a very small percentage that are not vaccinated that have gone into the Brownwood Hospital. Is that correct?
A very small percentage of vaccinated have been in the hospital. The majority of the patients in all 3 of our campuses are not vaccinated, are not fully vaccinated.
Okay, and I'm sorry, I may have asked that question backwards, but I understand.
That's okay. I've been very careful because it's easy to twist, but the majority of our patients are not vaccinated.
With having like those many patients in the ICU, is like Hendrick staffing? Are you guys still seeing a shortage? Are you guys having more beds moved into it? Can you just talk a little bit about that?
I can. And that's what, again, one of our fears and why we're releasing this information to the public so that they know truly the state of our healthcare in our community. We have 24 ICU beds in the North Campus. We have 18 in the South Campus. We are full. We've been on a wait list. The last surge that happened from October to the spring, we had upwards of over 100 patients in our hospital, but at that time we had almost 250 STAR resources, nurses, and respiratory therapists that the state had sent to help supplement our staffing. We have over 70 patients today. We have 73 COVID patients between our campuses, and we have received 0 assistance. So it is a struggle. Our staff members are the best, and they are troopers, and they are concerned about this community, and they work tirelessly, but they are very tired, and they want to send the message that this could be better if we were all part of the solution, and that is to get vaccinated.
Is there any hope you might get help in the future if needed, or was that just sort of a one-time thing?
That's still up for discussion. There was a conference call earlier today. I believe the governor is holding a session on Saturday to continue to talk about this topic. The plans, as I understand it from the state, were to do assistance differently this time. They were going to do it through local, city, and county officials, and not directly with the hospitals through the STAR request. And that is still being discussed and debated. But at this point, we've submitted 2 STAR requests for staffing, and both of those have been turned down, as have all others in the state.
We have a couple more minutes, so if we have maybe one more question. If not, we can go ahead and close it out, and I can then try to get this to you guys.
I'm good, Lynn, thanks.
Okay.
Quick question, last question here. What, I guess, advice would you kind of give to those parents with school starting in just like 2 weeks, sending them kids back to school, especially for those kids that's under the age of 12 that can't get vaccinated? What type of advice would you give to those parents?
So I would definitely have a discussion with your pediatrician and with your school and with your child on best practices. You know, children are very loving, and they love to give hugs, And it's hard to tell them to maintain their distance, but teaching them about hand hygiene when they're touching doorknobs and how to disinfect their hands and keep themselves clean, trying to refrain from that really close contact, that less than 6 feet distance for greater than 15 minutes, and maybe just changing some of the things that they do. We, of course, believe in masking, but masking protects everyone else. It's not a mask to protect themselves. And so unless everyone is masking, that's not always the solution. So the solution is not that masking doesn't work. We absolutely know that it works, but it requires everyone to do it. And so masking is great because it protects your friends and it protects others in the classroom. But if masking is not going to be promoted in the schools, and I do understand all the rationale, then teaching them about hand hygiene and how to keep themselves safe through the day would be a good discussion to have with your children.
Okay. Thank you guys for making the time to get on the call, and I will, everybody on the call, I can, unless you don't want me to speak now, I'll send you a recording somehow. Okay.
Thank you.
Thank
Take
you.
care. Bye.